I want to welcome you back to Aging in Place Strategies and Answers. And today we have another great topic for you. And I want to encourage you to hang in there with us because we're going to be talking about healthcare. But the reality is, healthcare does not need to be scary when you have tips and tools that can help you through the process. Here's a statistic I want to throw out first to get us started, and so that you understand where we are in healthcare and especially senior healthcare. But in the next 30 years, the number of folks age 65 is going to double. And so, of course, seniors use the healthcare system, and we find that the healthcare system is already struggling to provide evidence-based care to older adults at every interaction. So, to be totally honest, there are frustrations on the patient side, and I hear those frustrations daily from seniors, from their family members, from health professionals that are working with them. But on the other side of the picture is the physician. And there are just as many struggles there and frustrations for the physician. So, did you know that 40% of physicians are retiring early or they're leaving their clinical practice? They cite burnout, the workload, and the frustration they feel when they have to convince insurance companies to pay for their clients' treatment. They're concerned about moral injury, which describes this knowing what care the patient needs, but being unable to provide it due to constraints outside the doctor's control, whether that be insurance or whether that be systemic issues. So let's acknowledge that there does need to be a change. And today I have invited Hedva Barenholtz-Levy to be with me today. And she's been a guest on our show before. But Hedva is a geriatric pharmacist, which is a specialty. And she also has a well-established community-based senior practice. But I think it's been, would you say 2 years ago already that your book came out, Hedva?
1.5, almost two. Yep.
One and a half, almost two. And this is a book that you can get at the library or you can purchase it and put it in your library. And so it doesn't matter who you're talking to, this book is going to have an impact on you if you take any medications. Because the name of the book is Maybe It Is Your Medications. Maybe it's your medications. And then how to avoid unnecessary drug therapy and adverse drug reaction. So welcome back, Hedva. Thanks for being with us today.
My pleasure, Linda. Thanks for having me back. I
Uh,
appreciate that.
oh, yes, it's always a pleasure. So a month ago, Hedva and I were talking. And so I know that you know this about me is that I have a passion for what I do. But if and anybody who heard Hedva in season one, when she was talking about her book and what she was trying to accomplish in that work, is that we are both passionate about what we do, the information that we've learned in our careers, and how important it is for you to have this information. So I'm pretty much going to let her take this over, but just to give you hope and to let you know that we are not the only ones seeing the problems. This new age-friendly health systems initiative. So Hedva, go ahead and tell us about it and what's included in this, and then hopefully you'll help us figure out how we can have a better interaction in our, meetings with our healthcare professionals.
I'd be happy to. Thank you so much for, and this is a great chance to talk about this age-friendly healthcare system initiative, as you mentioned, because the more people who know about it, the more empowered we all can be to age in a more healthy manner, independently, where we want to, how we want to age, and really help drive our care. So, we'll talk about that for a bit. So I'm a pharmacist, and this is a health system initiative, if you will, but it partners very carefully, closely with the medications. And one of my pharmacy colleagues has been very involved in getting this age-friendly health movement off the ground, if you will. So I'm happy to be talking about it as well, because medications is such a part of our healthy aging. So the age-friendly health system movement was started back in 2017. So not that long ago, but
Okay.
a few years ago. It was created by the Institute for Healthcare Improvement, IHI, and the John A. Hartford Foundation. So it was a joint effort. And these agencies are all about improving healthcare and reducing medical errors and improving our processes and really trying to make the system, our healthcare, better. So this initiative came out of a need, the awareness that we have a gap in our healthcare provision. As we get older, there are gaps in the system. If you think about, it's not unfamiliar to the listeners, and I'm sure you've had so many, well, you have so many, had so many topics that talk about the complexities as we get older.
Yes,
So
ma'am.
healthcare becomes more fragmented. We have specialists involved. We have very few healthcare professionals who have that geriatric expertise. And as you mentioned, the physicians are leaving, they're retiring, there's burnout, there's overwhelm with these 7-minute visits and a lot of pressures on the doctors. So um, there's gaps in our healthcare system. And the Institute for Healthcare Improvement and John A. Hartford Foundation really did some research looking for evidence-based practices. How do we provide care to older adults that really show quality outcomes and improved healthcare outcomes? And they developed this age-friendly health systems movement, which is centered around the 4Ms framework. So we're going to talk about each of these 4Ms and what they mean. But the goal of this program, this movement, if you will, is to improve quality of care provided to older adults, to improve the patient satisfaction with the care they receive, to perhaps provide more consistent care, setting to setting. Every older adult deserves the same focus on the same key elements that evidence has shown really make a difference in improving health outcomes. So this whole age-friendly health systems movement is about improving the quality of care we provide as older adults from the healthcare professional, but the importance of talking about it to consumers, to the older adults and their caregivers, family caregivers and family members, is because their awareness helps them participate in a different way, more actively in their healthcare, in their healthcare.
And that's something that I advocate for all the time. So this is just very appropriate. And this is for you.
Yeah.
It's for you so that you can achieve your objectives and not just what is being told to you. So,
Right. It's a tool in your toolbox, right, that you can pull out and help drive your care and your involvement. And as I know, as we've talked with my focus as a pharmacist and with my book, it's all about being more involved in your care. So this dovetails really nicely with my passion as a geriatric pharmacist. So
mhm.
great to be able to talk about it. So and you mentioned the growth of our aging population. So for all these reasons, we have a healthcare system that is just not really prepared for an aging population, this age wave that's upon us. So the 4Ms framework, as I mentioned, it's evidence-based. The M's, each of the M's stand for, if you're ready, the first is matters most. So that person-centered care is what matters most.
Yes.
Medications, mobility, so the ability to move around, and mentation. So that involves cognitive function, but we can also think about it as mood a little bit, and
Okay.
that mental ability. So those 4Ms make up this framework. And the framework provides a structure, if you will, a common language for every healthcare encounter. What's really interesting, so let me slow down. I want to cover all these different aspects. It was developed for the healthcare systems. So to apply this age-friendly health system initiative with the 4Ms, focusing on those 4 components in a hospital setting, in a clinic, in a long-term care facility or rehabilitation facility, for
Okay.
example. So those healthcare settings. But when you think about these principles, in many ways, I feel I've been doing this, incorporating it in my pharmacy practice all these years. Think about any place where care is provided. So certainly in the pharmacy, and we do have an initiative where pharmacies can become age-friendly health systems, if you will. But even in when you're working with a social worker or physical therapy or occupational therapy, working with a care manager, we all should be thinking about the well-being of the consumer, the patient, you who are
Yes.
listening, from these perspectives. What matters most to you? And then how is the cognitive function, the physical function, that
Yes.
mobility piece, and then of course the medications. And if you think about these four M's, they're very interconnected. And as we talk about each one, I'll kind of move through each one a little bit separately. One affects the other. And so we need to think about them as a framework. So it gives us a language, if you will, wherever care is provided. I think even if the listener thinks about this tool, the 4M framework, even when they're speaking with their financial person or legal, housing, just all the different people that help us age together, age healthy, thinking about the different components might help identify a need or way to improve the quality of life, something that needs to be talked about. Does that make sense?
It does make sense to me because that's the way um, the company that I've worked for years approaches care, is that we're looking at those four things to see what can we accomplish in this picture, but what are your expectations, and then what are the factors that might prohibit you from meeting that expectation, but at least keeping what the patient wants at the center, and then trying to provide that as best we can, right? So
Exactly.
I'm all about this. This sounds phenomenal. And I agree with you that if you just learn those four words, that you can take this into any application of how you want to age. All right. So good. Let's learn
And
those words.
like I said, it's a tool to say, hey, I want to talk about this. It's important to me. So yeah. So, and I'm going to refer a little bit to notes, but so the first M is the what matters most, or so what matters or what or matters most, is that how the M is used of sorts. So really, it has to do with helping having a person think about what their priorities are, what their preferences are. Um, in thinking about what care they don't want is an important thing to think about, right? So it's a way to help avoid unwanted care.
Yes.
Um, so how do we get to that? It takes a lot of some introspection, and there's a little workbook that is available through the IHI,
That's good to know.
the Institute for Healthcare Improvement. So they can download a caregiver, I'm sorry, and I will be referring to it, My Health Checklist it's called, but it's a way to help individuals prepare for their healthcare appointment, if you will, a doctor appointment, or anytime you're meeting with someone in your regarding your healthcare. It's a really good way to kind of organize your thoughts and get them out of your mind and onto paper, and help prioritize what you want to talk about. Um, so when we think about what matters most, again, I'll come at it from the healthcare perspective, and as a pharmacist, um, patients have to understand the risks and benefits of any treatment option.
Yes.
Certainly, when you think about a medication or not a medication, or which of the two medications, or even with a healthcare procedure, surgery or non-surgery, what are the different ways we can manage the condition? So understanding the risks and benefits, balancing, we want to avoid overtreatment. So it all depends on what the person's personal situation is, how many healthcare conditions they're managing, how if they have frailty where there's more, more health problems going on, they need more assistance with daily activities versus they're more independent. So all of this really has to look at the person, and they have to be able to express and talk about what matters to them, what they find is what they feel is a priority for them at that point in life. And come to an agreement, if you will, with the healthcare professional who has all the knowledge of, we know, no, we know what's KNOW, we know what's the treatments or the recommendations of the guidelines, but we don't know you, the person, the patient who's involved. So those conversations have to happen. Um,
And I like to say that physicians, healthcare professionals are not detectives. Okay. So this is brings the onus onto you now. Now you're going to start at the beginning and say, I'm going to do my homework. So if you have not drawn up a healthcare directive or seen, how to have these conversations, let's start a conversation, which you can go back through some of my episodes, which we've talked about these things. This is where you decide. This is what I want. But if we don't communicate that to the physician, then how are they going to know what we want? Now, of course, I could say, how are we going to do that in 10 minutes, right? Because a lot of visits are 10 to 15 minutes. So we have to be forward thinking in this. But this is the first step, people.
And that, right, and that's where that there's a preparation guide, again, kind of thinking in advance. And that's why I love how you, when you talk, you explain things in such a practical manner. So I love the information you provide to all of us, Linda. How do you start those conversations, right? So, and maybe it's the patient who has to initiate the conversation, but from a healthcare perspective, again, the more we're teaching healthcare professionals about the four M's, they will know to initiate the conversations. But yes, you feel comfortable speaking up and know that you need to speak up. So that what matters most really is the center, the crux of the other three pieces, the other three M's we'll be talking about, of course. I'm going to go to the medications M next, right? As a
Okay,
pharmacist, I feel more comfortable there.
that's
But there's a
fine.
lot of information for the healthcare people about the medications component. We know that there are high risk medications in older adults. So there's better choices and less better choices, if you will, for the older patient. So safety issues, risk and benefit really has to be considered for different medications. So healthcare professionals need to be educated on what those higher risk medications are. Patients need to be educated to know that there are such things as higher risk medicines and to ask about them. Again, that's a lot of where my book goes and why I really wanted to put that good information out for people to understand that they've got to talk about risk and benefit. And when we think about medications, we want to make it easiest on the patient. So how do we simplify medication regimens to help you, the listener, the patient, the consumer, take their medications as easily as possible, so it's not interrupting their day. So to come up with a very simple regimen, maybe once a day, twice a day, make it with meals or things that naturally fit in the flow of your day, so you can take your medications more easily. The concept of getting rid of unnecessary medicines or lowering doses so we avoid problems. So those all have to do with the medication
Mhm.
issues. A really important concept to just introduce is that we call them care transitions or transitions of care. So for consumers to know, anytime you're moving between a hospital to home or hospital to a rehabilitation place and then to home, or even I hate to say it, but in between doctor offices, right? Because each doctor office has their own medicine list of sorts. Yes, there's that electronic record where it should be consistent, but doctors' offices might have slightly different information. So it's important for the person to be their biggest spokesperson, advocate
Yes.
about their medications. This is my list. Have it with them. Make sure that everyone's looking at that same medication list. And also that you know how to use your medications at home. Say you're given a new medicine as you leave the hospital, or a new drug is prescribed at the ambulatory clinic, at the doctor's office. You want to understand how to take that medicine and take it properly. So all these issues come up with the medications, and we can talk, of course, for an hour about that alone. But so the medication piece, and think about the medications affecting the other M's. Medications can affect cognitive function. Unfortunately, some medications can make you feel more drowsy, more groggy, forgetful. There's some direct memory issues with some of the medications. So there's that mentation piece can affect the medications, and medications can also affect the mobility when we think
Yes.
about fall risk, right?
Yeah, I wanted to just highlight two words that Hedva used when she was talking about medications, and that is risk and benefit. So, if you're thinking about your medications, the questions you need to ask are what's the risk? What's the benefit? And I've noticed that sometimes it is not the doctor that's reviewing that with somebody, it is actually maybe somebody in the office that says this is what's been prescribed. So if you don't know your risks and benefits and how long you're going to take that medication, and what if there's a cost factor to this, these are all reportable things. I know that pharmacy representatives come to the doctor's office with their products, but it's also good to review the risk and benefit with your physician because you're the one who is going to be affected by it. And so, if that's important to you, which it's important to me because Hedva's book talks about the adverse risk sometimes of too many medications. So, you are your advocate. Risk. So, we think of medications now, risk and benefit. Easy question, easy words to remember. Thank you. I'm so glad you told me about that medication. What's the risk and what's the benefit? How long do you think I'm going to be taking this medication? And do you want me to report back if I have an adverse reaction in how many days? How long? They should know that information if they're prescribing the medication, right? And if they don't discuss that with you, could their local pharmacist help them with that?
Absolutely. And I always say
Okay.
the pharmacist is sometimes underutilized, but absolutely
Absolutely.
ask your pharmacist.
Okay, so
Sure. Yep.
if you forget to ask the doctor, because it will happen, then you know when you go to get your med.
Yeah. And I always say check both ways. Get it from the doctor and
Okay.
still ask at the pharmacy, right? So one, you want to make sure that you're getting the same information, and it never hurts to hear something a second time, just to
Yes.
drill it in. So
Thank you.
either way, um, yeah, those are just key points, that risk benefit, because that we don't always think about that. We assume medications are just fine, and they're not always. So, and I guess the one big thing I should say about medications is we want to choose age-friendly medications. And
Yes.
so those are the ones that are less risky. Though, as I mentioned, there's those a group of medicines that tend to have more harm associated with them. As we get older, we're at higher risk or more susceptible to the side effects of certain medicines. We want to avoid those when possible, so we can use age-friendly. It's all about not taking away anything from our quality of life and our well-being.
Good. I like it.
Um, all right. So then that was matters most medications. The third M I'll talk about is mentation or mind. I mentioned mood, that kind of thing. And with this M, the framework talks about really focusing on uh, dementia, depression, and delirium.
All
So
right.
it recommends that the healthcare team, the healthcare professionals, when working with older adults, focus on identifying screening for those three conditions and addressing them, treating them where possible. Delirium is a situation you want to prevent. It's about prevention mostly. We think of delirium happening in the hospital setting, unfortunately, most commonly, but focusing on ways to prevent delirium. So that's for our health system colleagues and practitioners really should be focusing on preventing delirium. The dementia and depression can happen anywhere, of course, but as we're caring for older adults, age-friendly care means that we're screening for and being aware of cognitive changes. So mild cognitive impairment, those early signs of what could be dementia, because sometimes it's reversible, again, coming back to the medications piece of it.
Yes. Yes.
But we'll talk about some other healthy lifestyle things that can help our mentation, our mind, and then depression as well. And as we get older, with loss, with isolation, that the risk of depression is a little bit higher, and we need to look for it because it's treatable, and we can, and always necessarily with medication, but we can intervene to address those issues, which really can impact quality of life.
Of course they can.
So, so there's recommendations again for the healthcare professionals, because when we think about this age-friendly health initiative and the four M's, we're thinking about it from both the bigger picture, the healthcare systems looking down on how do we improve the care. So from that perspective, we need that education. So the healthcare providers should be educated to do some kind of routine screening for changes in cognition and depression. Make sure the older adults have their hearing aids or glasses with them when they're in the hospital setting or wherever their, care is provided. You think about the rehabilitation place or a hospital or skilled nursing. Make sure that everything, all the tools that someone needs to be most fully engaged, they have them with them, right? So I'm sure that you've heard many stories or maybe even talked about if someone doesn't have their hearing aids with them, how confusing and disorienting it can be when they're in the hospital setting and they can't hear properly to interact with their care team, right?
Absolutely. I have a friend who has been in that situation, and she said, "I'm really having trouble seeing my laptop." And I asked her, I said, "Well, did you have cataracts? Did you have surgery?" And she said, "Yes." But she said, "I ordered new glasses before I had my stroke, and so now I don't have them." And so I said, "Well, we need to solve that problem." So then the next problem we were trying to solve was hearing, because she couldn't hear what people were saying. So, Hedva's right. That does make such a difference. And my listeners will know that I interviewed a daughter of somebody who was being tested for dementia, but it was the way the test was administered. So the medical assistant had her back to the patient and was wearing a mask. And this is a senior patient. But how often do you need to see their lips move or you need to see their face? But now you're judging my ability cognitively and you haven't administered the test. So this is a key component. And so we want our seniors and all patients to have that access to good test administration. And so if you're the advocate that's going to the appointment with them, bring those things up. Be bold. I'm challenging you. Hedva and I are challenging you to be bold and speak up. And so after this test was administered, the doctor came in and said, your mother has dementia. And this daughter just went nuts, not in a bad way, but just like, how can you say that? This is how the test was administered.
And that shouldn't, in this age-friendly health initiative where we're really trying to bring it to the forefront of the provider's attention, we have to be age-friendly as we do this to not let that happen. So yeah, that's a horrible story, but an example of
Yeah, it's
why
just
we
an
need to
example.
advocate. Absolutely.
Absolutely. Hmm.
Um,
Yes.
and then with the mentation piece, the good news is that with lifestyle changes, we can kind of preserve our cognitive function. We can, there's a study that was recently published in persons over the age of 65 without any cognitive impairment, no dementia. They were tracked for over time with just by following healthy lifestyle interventions. So things like getting enough sleep and enough exercise, having their blood pressure and cholesterol controlled and their blood sugar controlled. I mentioned the physical activity and eating a healthy diet, for example. And these types of healthy behaviors were associated with a lower risk of developing cognitive impairment over time. So I am just such a promoter of what we can do without medications to try and be as healthy as we can. Um, so that's the mentation piece, right? So we can imagine and think about, so I mentioned how medications can affect mentation or cognitive function. If there is cognitive impairment or dementia going on, even depression, that might decrease the mobility, right? So that can interrelate with the mobility piece. So these are all very, very interconnected, which is, I guess, the segue to the fourth M, which is mobility.
Right.
So it's important with this M that the healthcare team and the listeners think about ensuring the patient is able to move safely, to maintain function, and do what matters most, right? So we do all those things that we want to enjoy, but how do we ensure that the person has that mobility? So that's everything from making sure the home environment is minimizing risks, right? Doing that fall risk checklist of throw rugs and clutter and all that wonderful stuff. But in the hospital setting, again, really important focus of this health systems initiative, obviously, and in the hospital setting is where we can really control much of this interaction that we have, but ambulating while you're in the hospital. And this is where it's important to have a caregiver with you. Learn how to help the person, the patient, ambulate safely if it's help getting out of bed or into bed or to the toilet. It's important for the caregiver to be involved during that hospital stay, because if the help is needed once the person goes home, the caregiver is trained and has that experience, right? So really thinking ahead of how to promote that mobility piece. And it might start in the hospital setting. It might be someone advocating that the person needs to get up 3 times a day just to move,
Hmm.
as long as it's feasible, obviously. But I
Right.
think hospitals are really looking at how to make even if there's IVs or, things that are being hooked up to make that mobile so the person at least can get up and move around a little bit. So there's a lot of talk about the mobility in the hospital setting. But I'm out in the community. That's where my focus is when I meet with my clients. How can we encourage people to be active wherever they reside, right? So maybe educating the listener should know that it's important to move. Being sedentary is one of the most, may I say, one of the most dangerous things we can do. It leads to inflammation, which leads to chronic conditions and all that. So I always think a body in motion stays in motion. So how
Yes.
can we encourage people make sure they know so many minutes per day, per week are important to move and have some type of physical activity. And maybe having that extra motivation, understanding how important it is to stay active and moving as however we are able, right? There's many ways to stay active.
Mhm.
Um, that might help with the motivation and fitting it into a routine, making sure it happens every day.
Yes, I
So,
did a podcast, I believe, on lifestyle medicine, and that more
mhm.
doctors are starting to write prescriptions for, 30 minutes of exercise 5 times a day, or, sending people to therapy. Uh, and I do think that hospitals are doing a little bit better job in my line of sight on getting people out of bed to see if they can move. But bear
Yeah.
in mind, if you're listening to this and you have a loved one in the hospital, anytime you're laying in bed, you start that decline. Then you have an illness or something that you're trying to overcome, or it's a medication, or it's a surgery, or there's some reason, some acute reason why someone went to the hospital. So the factor that they might not be able to move like they did before is going to be, could be significant, could be minor. They're going to fall somewhere in that perspective. So make sure that if you're the caregiver that's bringing them home, as Hedva said, that you've evaluated that. And if you don't have a good feel about that, then that's something that you need to bring to the attention of the health professional. Has therapy been in to evaluate my loved ones or the person I'm watching over, their ability to their mobility? Okay. So having those four M's is huge, right? Because you know what those words are. You can remember them easily. I could even say, "Oh, I love M&Ms," and then just have the four M's after
They
that.
just fall right after that.
Yeah, they
Sure.
just fall right after that. So that's very, very helpful. I appreciate that because when someone is trying to figure out next step, mobility is one of the top questions we ask because you want to bring your loved one home, but if you cannot work with them in their present condition, that's another conversation. And people improve. Otherwise, they wouldn't call it rehab. So don't be afraid. You just need to know that the resources are available, but you might have to push or ask questions.
Be that little advocate, the advocate, the good squeaky wheel.
Yes.
Um, and then what might be hindering the ability to move around and think I want to bring up pain. Often pain is a hindering our ability to be as mobile as we want to. So that then go back to our medication M. How can the medications help improve the pain to help the mobility? So again,
Yes.
age-friendly medications that might help with the mobility piece, right? So don't be afraid to find out what is the problem, what's the limitation, and how can we address it? Be it pain, you mentioned strength, and the more we lay in bed and not moving, if we're in an acute hospital situation, the physical strength starts decreasing. So how do we regain strength? Balance is key. And then, of course, coming back to the medications that can lead to balance problems, drowsiness, just being unsteady on the feet. Lots of different ways that medications can affect that mobility in a negative way. Of course, pain med control is another one in a good way, like I mentioned.
Yes.
Um, so that education and speaking up for how you can help care for your loved one who is coming home from the hospital or for yourself. So just think about aging in place and staying healthy and strong. So that covers the four M's. And then we can talk about the tool, the checklist, if you will, that workbook that can help you prepare for your medical encounter, your medical visit, the doctor visit is the easiest way to think about that.
Do you have a
Um,
website that I can put it in the show notes for people.
yes,
But yeah, so we'll get the website of where you can where you can get that worksheet of
download.
how you can then get set for your next appointment
Yeah.
and start the
So
process.
it's a good little resource, I think. So yeah, we'll put that in the show notes. Um, but I guess I'm trying to think of any like summary comments. So I hope it's clear to the listeners the value of knowing about those four M's. They're easy to remember, hopefully, And it's a way to help you advocate and advocate for better care. And if the more we talk about the 4Ms and age-friendly care, the more it will grow and spread throughout the country. So, because it is a fairly new movement, right? 2017 isn't that long ago, and we're really trying to get it to spread to every place where we receive care.
Yes,
Um,
I think that when you approach your healthcare team from the perspective that this is who I am, and I understand that this is where I am right now in my diagnosis or what has happened to me, okay? But this is what I want to get back to. And so that that shows that you're somebody different than they're talking to. All right. So right away, you've got their attention. And I say this because some of my listeners know that I had broken my foot in the fall. And so I had to say to my physician, okay, this is what you're recommending. This is who I am. So you think that my age, that I don't do these things. But prior to falling, I had just run a 5K. Okay, I bike, I walk. I'm a very active person. And so this is where I want to get back to. So when he said, "You're done," I said, "I'm not done because I'm not there." And so then he advocated for therapy for me. So at the end of our time together, the doctor said, "You've been a great patient." And I said, "Thank you. You've been a great doctor." So it was a very positive outcome. He said, "Come back anytime." I said, "No, thank you. I will be happy to refer you, but I
don't
would
want.
prefer that you and I do not see each other for a very long time or ever again, and don't take that personally."
Exactly. But he
So,
got you where you needed to be, and you knew you spoke up, which when
yes.
you see that story, it's so important.
Yes,
Yeah.
but I was that patient. All right. I did have pain. I did have surgery. And so I did feel a little hesitant to advocate for myself. But the relationship that was developed when I opened my mouth was the big thing. So we're not there to be a problem. We're there. The reason why you're going to your physician is to get help. Now their job is, if you're asking me how I can help you, I'm the expert. I will get you there. But I want to know my risks. I want to know my benefits. I want to know if there are other treatments, and I want to have a real conversation about that. So if that's not available in a 10 or 15-minute increment of time, do I need to come back in for a consultation? Or can we do this virtually, or can we do this over the phone, or how does this work? But Hedva's saying, "You're in the driver's seat here." And now the initiative has been launched. 2017 was what you had said. So pre-COVID, this initiative was launched. Do you have any reading of where we are in this as far as this initiative? I mean, it's coming
Oh,
down through to pharmacists, right? So
right. So what's interesting, so through one of my pharmacy associations that has been partnering with the IHI and the foundation, pharmacists are becoming, pharmacies, but also pharmacists can get a badge for age-friendly accreditation, if you will. So that's next on my to-do list because I've been talking about it, I believe in it so much. So if you go to the website, they talk about how many hospitals have picked it up throughout the country, but there's
wonderful.
always more to do, more to go. But there's just a bigger launch in the last couple years to really get this out. And I think I mentioned at the beginning that the 4Ms framework is evidence-based. And I read more about what all that means, um, the foundation in developing what is the framework going to be, what is this health initiative going to look like, they surveyed the older adult care programs that are in hospitals and the community setting to find out what really matters, what improves outcomes, and that's where these 4Ms come from. So knowing that we need to talk about what matters most, the medications, mentation, and mobility, really it's evidence-based, so it's really important. But so I was just talk through some of the questions in the workbook. So when you think about like how can I really use this information? I'm going to have a doctor's visit in the next week or whatever. So you kind of the workbook walks you through each of those M's and has prompts for you to answer, if you will. So when you think about what matters most, think about where you are now, what's working, what's important to you right now. And I was also going to mention things change even month to month, depending on your situation, but certainly at every year, you could be at a different place where with what your priorities are, how your health is. So some of this might change for you. So
Hmm.
it's important to always rethink it. So, um, so with the what matters, what's important to you right now? What has changed since the last medical appointment, last time you saw that doctor?
Okay.
What's going well? What activities do you like to do? What means something? What means most to you? Is it running the 5K? Is it playing music? So just to let the healthcare person know what matters to you.
Hmm.
And then also what could be better, right? So
All right.
if there's something you want to look at, how do you articulate that, write it down and have it ready so you can because we do have to choose priorities. There's a lot that you can put out when you do go through this work, but what could be better? Your sleep, your energy, that you're not yet able to run as far as you used to, right? Things like that.
Hmm.
And then anything else you would want to share with the provider. So you just put those thoughts together, which at least starts getting your juices flowing. What's
Yes.
good? What is missing? With the medication piece, same component. What's your situation now? So what are all the medicines you're taking? And as I am a big proponent of including everything you're taking, including your non-prescription and your supplements and things like that. So what is all that you are taking of your medications? What's going well? Where do you think the medications are helping you? And then where do you think you're having some side effects, cost issues? What are the reservations? Even the adherence piece, able to follow the instructions of the medications and take them as as they should be taken. If you know you're skipping doses for some reason, it's a middle of the day dose, or it's too expensive, or you're worried about side effects, those pieces of information need to go into the workbook so you're ready to talk to your doctor about them.
All
And
right.
then, so what could be better? And then what questions do you have? With Mind, there's a series of questions that ask about how happy you are, any changes in your memory. So helping you work through um, memory issues, depression issues, things like that. What's going well and what could be better, that same type of thing, and what questions you might have. And then the mobility piece, same type of thing. So what's your situation? How do you move around the house now? How do you get from place to place? Are you able to drive? Do you have someone you rely on for transportation? How is that going? What could be better? What are some concerns about what, your balance, feeling unsteady or being short of breath or things like that? Maybe it's harder to reach things. So what is affecting your life right now with mobility things? So there's some prompts with that. And then once you kind of work through all that stuff, which can be a lot of information, they encourage you to kind of look back at all of your answers and prioritize the top three.
All
If
right.
you have that limited time, what are the top three that might be the most important things to talk about at this visit?
All right.
And so it kind of guides you through that. Um, and bring the workbook with you then. So it just helps you put together, think through those four M's, what's most important, what do you wish for, what's going well, and then helps you siphon it out to what is the most important to talk about at this visit. So it's kind of an interesting tool to bring all that together.
I think it's going to be great, Hedva, and I cannot thank you enough for bringing this out so that we can minimize some of our frustrations and that our physicians will feel like they're really helping people, that our healthcare professionals really are completing the task that they have dedicated their education and their time and talents to. So I think this is going to be a win for everybody. Um, how do we get in touch with you if we want to know more about your practice and just to make a connection with you? What's the best way to get in touch with you?
My website is probably the easiest way. You can fill out the contact form and access me there. HBLpharm.com, HBLPHARM.com is my website. And from there is a link to and more information about my book. And I just want to mention that again, because when we talk about tools to help people be knowledgeable and ask the right questions, that's another resource out there for people that I feel very passionate about as well. But yeah, just reach me through my website is probably the easiest way.
Wonderful. I always ask my guests to give us a caregiver tip. Did you think of one that you wanted to share with my listeners today?
Well, this is fun because this isn't necessarily about the medications, and I'm usually always talking about medications, but this is just that different focus about the four M's. So I think the tip I want to leave with the listeners is use this 4M framework as you prepare for each visit. We talked about how they're all interconnected. It's a way to advocate for yourself regarding what matters most, especially with that drug therapy. So it applies to any situation. But use that 4M framework next time you have a doctor visit and use it as a structure to advocate for
I
your
love
care.
it. I think it's so great because if you're a caregiver for somebody, you can ask. That's a great tool for you to make sure that you're advocating what your the person you're caring for wants, not what you want or not what the family wants, right? It's what that person has communicated. But then also it helps you to think through your objectives as well. And then everybody wins. And that's what we're
Absolutely.
after. And I would also encourage you to go back through the seasons that I have of podcasts because I talk about some of these things that, we're sitting here with Hedva. How many years do you have of experience, Hedva, in your field?
25 years, I guess it's adding up, but over 20
Yes,
years.
it is. And so, in 20 plus years for myself, and we're not making this up. If I could, I'd take you downstairs and show you my refrigerator. And on the refrigerator, I have the Mind diet because when I'm talking about lifestyle, I'm living. I'm trying to live that lifestyle change. So we're just not saying this just because we're supposed to be saying it. We really believe it. And that's why I invited Hedva back on because she was so passionate about this. I called her back and I said, Hedva, you've got to come on my podcast. Do you have time? So she did that for us today. And I thank you so much. Listeners, this is also going to be a YouTube in case you want to see what Dr. Levy looks like. And we'd love for you to share this with somebody that you know needs this information. So thanks for listening today. And thanks for being with us, Hedva. Thank you for joining me today. Are you ready to learn more? Go to seniorsupportstrategies.com. As always, I value the time you spend with me.